It's not always easy to recognize unsafe practices in a nurse with substance use disorder. Sometimes it's tough to differentiate between the subtle signs of impairment and stress-related behaviors. Three things to watch for are behavior changes, physical signs, and the diversion of drugs. Behavioral changes can include shifts in job performance, like absences from the unit for extended periods, frequent trips to the bathroom, arriving late or leaving early, and an excessive number of mistakes, including medication errors. Behavioral changes can also include subtle changes in appearance that escalate over time, wearing long sleeves in warm weather, increasing isolation from colleagues, inappropriate verbal or emotional responses, or diminished alertness, confusion, or memory lapses. When nurses are using drugs and unable to obtain them from a treating physician, they may turn to the workplace for access or diversion, often causing narcotics discrepancies. These might include incorrect counts, large amounts of wastage, numerous corrections of records, frequent reports of ineffective pain relief from patients, offers to medicate coworkers' patients for pain, altered verbal or phone medication orders, and variations in controlled substance discrepancies among shifts or days of the week. Nurse managers and colleagues often don't recognize the warning signs of a substance use disorder in a nurse coworker. They may misread cues and look for other explanations for behaviors. In fact, many nurses with substance use disorder are unidentified, unreported, untreated, and continue to practice. This finding highlights the need for education about substance use disorder for all staff members. It's especially important for the nurse manager to be able to address the signs and symptoms of substance use disorder in a transparent, supportive way. Nurse managers should work to encourage open dialogue and educate staff that substance use disorder is a medical condition, not a personal failure. Nurse managers are also responsible for ensuring that coworkers understand they have a professional and ethical responsibility to report a colleague's suspected drug use to the nurse manager, and in some states or jurisdictions, to their board of nursing.